Back now with 9 News Director reporting Chris Vanderveen, who has been tracking Colorado's COVID-19 situation day by day since the start of the pandemic. We're going to make this kind of an ongoing conversation. Chris, the decision today by Denver to put in this 10 p.m. strongly worded request, what does Denver think that it's going to accomplish with this quasi-curfew?
You get the sense, Kyle, that think of it like a toolbox. And I don't want to be terribly cliche here, but really, literally think of it as a toolbox. They've taken all of the tools out of the toolbox. And really one of the last things they have to do now is tell everyone to stay home starting at 10 o'clock. Is it going to do a whole lot? Probably not. Is it going to send a message to everyone in Denver that we've got to get really serious about this? Perhaps. But they've run out of tools in the toolbox, and once you run out of that, then the next option is the option that nobody wants to get to right now, which is that stay-at-home order. The mayor was asked a lot about it today, also the Denver Department of Public Health, and really the answer is we don't want to go there. We don't want to have that happen, but we're running out of options. We're running out of tools, and that's what you're seeing right now.
It strikes me that there are a couple of ways to look at this. One is that it's a signal that a lockdown is probably inevitable. Another way to look at it would be that we should be at lockdown status now based on the numbers, but the city is not going to do that. Or maybe I'm wrong on both counts. How do you read it?
I don't know if a lockdown is necessarily inevitable. The big problem that you have right now with a lockdown is that all of the financial backing that went into the first lockdown that we had back in March and April, when you were starting to see money come in from the federal government, that now is, right now, that's not there. That backstop, as I've been calling it throughout the day, that's not there. So the unemployment insurance, the expanded unemployment benefits, the PPP issues, that's not there right now. So the devastation, they know that if they make that additional step, economically, it's going to be really difficult. I'm not saying it's not going to happen. I think it's very possible. In fact, you're hearing a lot more people talk about stay-at-home orders just this week, a lot more than last week. But again, everyone knows what that decision means for the economy, and not just for an economic standpoint, but from just a business standpoint, people's livelihood standpoint. This is a real issue for people, so they don't want to take that next step. But again, like I said before, they're running out of options.
And we think about how crushing economically that first lockdown was. We don't have anything resembling a functional Congress. The Electoral College suggests that we may soon have a lame duck president who would not be incentivized to get anything done. So the help would not be coming. And you got to think, Chris, so many small businesses in Colorado burned through everything that they had to make it through that first lockdown to stay afloat.
That's what's so fascinating about this, Kyle, in a very sort of tragic way, is that so many businesses have been hanging on for months and months saying, we got to see, maybe we see the light at the end of the tunnel. And now that the light at the end of the tunnel keeps getting further and further away, and then you add on to that, which would be severe economic restrictions would come with a lockdown, and then they may never see that light at the end of the tunnel. And I think there's so many people, so many small businesses. These are our neighbors. These are our friends. These are people we work with. These are our own businesses, not just small businesses, but large businesses in general that are going to really suffer from this. And the long-term consequences of that could be devastating, but you're really going to see it acutely on sort of the small business standpoint at the beginning.
We're watching hospitalizations spike. We've passed the peak in the spring, and we just continue on that upward trajectory. So it looks like we're going to head to a new peak well in excess of the spring peak. But yet we've not seen the spike in deaths. Last time we had this conversation, I wondered aloud if perhaps we just had tens of thousands of Coloradans getting sick, but not dying by the dozens every day, if the state wouldn't just say, we're just going to plow ahead and not lock things down.
Deaths, interesting. I've noticed it just this week, Kyle. Deaths have started to go up, where about a month or two ago we were seeing 3 to 4 a day. Now we're seeing 8 to 9. Statistically, that's significant. It's not what we saw back in March and April, where we were seeing around 30 to 35 a day in the state of Colorado. But it's that upward trend. And this idea that deaths are not going to come, I think, has already been disproven by what you've seen this week. We have seen a gradual uptick. Now, the issue is what happens, and we talked about this a lot, Kyle, in the office, is what happens if hospitals get so full that you start to have a staffing ratio issue. That really is a concern as well, because it's not just a bricks and mortar issue. How many patients can you put into a hospital? It's also how many people can serve those patients while they're in the hospital. There's not an infinite supply of personnel. This is a labor-intensive disease. This is a labor-intensive virus. And if you run out of those people, then you really will start to see some of those health long-term impacts of people just not being, the numbers don't add up, the ratios just aren't there.
The state modeler saying that that could happen by the end of December or even mid-December if people don't limit Thanksgiving contacts. Chris, just quickly reminds, what's the stopping distance of the truck? If we look up tomorrow and say deaths are headed out of control, lock it down now, the truck doesn't stop immediately.
No, and sort of look at it from a case to hospitalizations perspective. If cases were to peak today, we would likely still see the hospitalizations continue to go up for another 2 weeks. And that's really the concern right now. We're right around 900 patients right now in Colorado, but we're likely to see over 1,000 by next week. So again, if cases stop tomorrow, hospitalizations would go up for another 2 weeks, and you wouldn't see the impact on deaths for another 3, 4, 5, 6 weeks after that. We talk a lot about this, that data lags. This is the meaning of that. If things got safe today in terms of cases, deaths would still go up for another 6 weeks.
Lastly, Chris, I keep replaying in my mind a note that I got yesterday from a Next viewer who emailed in to say, the state is asking me to give up what I need most in my life right now, that Thanksgiving is coming, and these are the 15 people that I want to gather for my own mental health. This is what I need most, and that's what they're asking me to give up. And it just occurs to me, that ignoring these public health orders and common medical sense is killing people, and following these orders is killing people.
I don't think we've talked enough about that on our newscast. I think this is a mental health crisis that this country is going into, has been going into for a number of months, and it can't be downplayed. Now, what the solution to that is, I don't know. But there are people that are suffering not just physically, not just economically, but mentally as well. And we have been living our lives confined by space over the last 6, 7, 8 months. And what is the long-term impact of that going to be for many, many months to come? You've got to feel, we're asking people to do something we're not used to doing ourselves, in being sort of locking ourselves up, being away from people. And for introverts, sort of like me, it's maybe not necessarily a bad thing, but for people who depend on other people, this can be devastating for them.
Yeah. I know people ask us all the time about our personal choices. For me and my family, we're gonna buckle down, and we're gonna do our part. If nothing else, for those small business owners, that if we can shoulder some of that pain for the next couple of weeks, and it keeps them in the game, that's a sacrifice that we've decided is worth making.
Absolutely, it's a sacrifice I think a lot of people are saying, and I think that's the frustration, is that a lot of people are making those sacrifices, and they want to see the light at the end of the tunnel. Yeah. The question is, where is that light?
All right, Chris, thank you.
You bet.